There are certain indications of using forceps. The maternal indications include maternal distress, maternal exhaustion or poor maternal effort, prolonged second stage, inability to push efficiently due to cardiac, hepatic, or pulmonary diseases. The fetal indications include fetal distress in the second stage, delivery of after-coming head and breech delivery, prematurity, face presentation, or malposition. The parts of the forceps include the handle, the lock, shank, and the blade. And this is the cephalic curvature and pelvic curvature. There are three kinds of forceps. First is the Wrigley forceps, which is the smallest. Secondly, we have the Simpson forceps, which is medium in size, and they are both non-rotational forceps. And lastly, we have the Piper forceps, which is a rotational and the longest forceps. Wrigley forceps is considered an outlet forceps used when the head is almost to crowning and in cesarean section. It has a small handle and shank. Simpson forceps, it is the most commonly used in vaginal delivery. It has indentation on the handle for better grip and a short shank but longer than the Wrigley's. Piper forceps is a rotational or high outlet forceps. It has more complication than Wrigley forceps. It's used in breech presentation for the delivery of the head, and it has a curved shank and a long handle. For forceps assembly, first, the left hand should hold the base of the left handle like a pin pointing downward and perpendicular. After that, start going downward perpendicular, inserting it to the right border of the pelvis. Then, ask the help of a nurse to hold the shaft while assembling the right part of the forceps toward the left border of the pelvis using the same technique, and end up by placing the shaft on the top of the other shaft to lock it. Before locking the forceps, make sure that the ears are in between the blades. When the mother is pushing during uterine contraction, start pulling the baby with a constant pressure slightly downward and put the left hand on the top of the forceps as a support. When the head reaches the perineum and start crowning, start pulling upward. When the head is delivered, remove the forceps as they were applied and deliver the baby.